Saranna Kundu.
This call is now being recorded.
Good evening.
Yes, sir. Good evening,
Okay.
sir.
Yes, sir.
After Saranna, who is there?
Laboni, sir.
Lavoni. Lavoni is ready?
Yes, sir. Ready.
Okay. Thank you. Then Koustav, then who is there? One by
No,
one. Just
first, Saranna will present.
first Saranna will present. Huh?
Okay, then we
Actually,
have Fatma, Koustav,
Mafuza. Mafuza is at the last. Actually, I have sent you the PPT. It was actually very late, 3:34 p.m. I have sent you.
But I have not got any PPT.
Yes, from my another mail ID, cognized.nutri.
Then I think I have overlooked.
Oh, sorry. ठीक है, मैं start करता हूँ. Okay.
Right.
Sharona, you will tell your name, topic, and then we will start. Okay.
Okay, sir.
Just tell me the screen is being shared. Yes.
Yes, sir.
So welcome, Sharona.
So
Thank
many
you, sir.
slides. I asked only one slide.
एक दो जस्ट पिक्टोरियल बना दिया है. हाँ, अच्छा मैं म्यूट करता
So
हूँ.
many. I don't want. I want only the point. That's it. I don't want to see so many things.
आप लोग पॉइंट डिस्कस करो. ओके, चलो.
Good evening to all. I am Saranna Kundu from Shamnagar. I have completed my master degree. Today, I want to discuss about the association of the liver disease with estrogen. Here, I want to represent the estrogen according to its function. Let's see what it is. E for excitability of myocytes. S stands for sex hormone binding globulins. T stands for testosterone is origin. R stands for redistribution of fat. O stands for ovarian growth. G stands for good cholesterol. It's mean HDL cholesterol. E stands for endometrial growth and N stands for nuclear receptors. Naturally, there are three types of estrogen. First one is estradiol, which is secreted by
Please come
ovary.
to the point. I don't want so much of explanation. I just asked what is the role of liver in estrogen. I don't want types of estrogen and what is its background. I wanted only one slide, the function of estrogen. What is the relation between liver and estrogen? That's it.
Okay, ma'am. Ma'am, there is different types of disease uh, which are related to the estrogen and liver, such as hepatic steatosis, hepatic fibrosis, cirrhosis, hepatic sarcoma, autoimmune liver disease, hepatic insulin resistance, carcinoma, hepatic insulin resistance, etc. Hepatitis C virus infection are recognized as a major causative factor of chronic liver disease. A characteristic features of chronic hepatitis
Just I
C.
will request you not to read the slide. Just give the point what you have understood and make us understand. Okay. If you read line by line, everyone can see what is in the slide.
Okay,
Just
sir.
the gist of the slide.
Okay, sir. There is I'm representing. There is some relationship between liver disease and estrogen when basically chronic liver disease and these all things are more rapidly common in men than the women because estro and the post menstrual women also because there is some deficiency of the estrogen. For this reason liver disease is so common there, and there is all things which are related to the liver because There is some lipid metabolism which is related to the decrease LDL level and higher the HDL level, which is associated with the estrogen. For this reason, it's really helpful to us. That's all, sir.
ফাংশনই তো হলো না।
So, ma'am, ফার্স্ট স্লাইডে ফাংশন অ্যাকর্ডিং করেই আমি ওই ইয়েটা লিখেছিলাম।
আরে আমি তো ইস্ট্রোজেনের ফাংশন চাইনি বাবা, প্রশ্নটাই তো বোঝোনি। I asked কি লিভারের ইস্ট্রোজেনের সমস্যা হলে লিভারে কি হয়, বা ইস্ট্রোজেনের অ্যাকশন লিভারে কি আছে। ইস্ট্রোজেন খেলে কি হয়? What is estrogen?
So hormones, ma'am.
হ্যাঁ, সো লিভারের ওর কি অ্যাকশন?
লিভারে ওর অ্যাকশন হচ্ছে আমাদের বডিতেও ফ্যাট মানে ফ্যাট লেভেলটাকে কমাতে, মানে গুড ফ্যাটটাকে বাড়াতে হেল্প করছে, আর ব্যাড ফ্যাটটাকে কমাতে হেল্প করছে। তাই জন্য লিভারের সাথে লিভার ব্যাড ফ্যাটকে হলে তো আমাদের লিভারের ডিজিজটা আরো বাড়বে, তাই জন্য।
Can anybody give me the answer?
হ্যাঁ, ইয়েস, আই অলসো ওয়ান্ট দ্য আনসার। কেউ একটু এক্সপ্রেস করতে পারবে? আমি কিন্তু ওদের শুধু হোমওয়ার্কটা দেয়নি ম্যাডাম, আমি বলেছিলাম সবাই করে রাখবে। ও অনেকটাই ভালো করেছে, কিন্তু এক্সাক্ট জায়গাটা আর একটু জানতে চাই। এনিওয়ান? হ্যাঁ, পত্রালিখা হাত তুলেছে। পত্রালিখা বলো।
ইস্ট্রোজেন অ্যাকচুয়ালি মেনটেন করে হিমোস্টেসিস মেকানিজমটাকে লিভারে।
কি হেমোস্ট্যাসিস শুনি কিভাবে?
Actually, মানে hemostasis তো is a process of to prevent stop মানে bleeding stopping mechanism hemostasis। তো এই ফাংশনটা ইস্ট্রোজেন লিভারে করে।
ওকে ফাইন,
Help
প্লিজ।
করে।
অনেক ধরনের এইসব আসছে। এবার I'll answer it at the next presentation.
Okay, so ma'am will answer at the end. So I am going to the next.
It's only one line answer.
So we are expecting this answer. So Laboni, are you there?
Yes, sir.
Okay.
কি আজকে কি গুগলে এত কিছু করেছো, গুগল থেকে এটা ফাইন্ড আউট করতে পারলে না কেন?
জাস্ট একটা লাইন। হ্যাঁ, আমি সেটাই বলতে যাচ্ছিলাম।
কারণ কি জানো তো সোমেন্দু? কারণ কি এভরিথিং ইজ নট দেয়ার ইন গুগল।
সেটা তো বললামই, আমি দুপুরেও বললাম, আমি একদম ওদের টাইমও দিতে পারিনি, ওরা পাঠিয়েছে। আচ্ছা, আমি চলে যাই উইদাউট ওয়েস্টিং টাইম। দেন ওকে, ওয়েলকাম লাবণী।
Okay, sir. Thank you, sir. Thank you, ma'am. Good evening, ma'am. Good evening, sir.
Good evening.
Sir, I am Tanjina Labuni from Bangladesh. I completed my MS in Food and Nutrition from University of Dhaka. Today, I discuss about testosterone and its role in liver. First, I discuss what is testosterone. Testosterone is a male sex hormone that is important for sexual and representative development. Women also produce testosterone, but a lower level of than men. Then I discuss about function of testosterone. Testosterone is the only male sex hormone which causes physical changes in puberty, and it regulates fertility. Testosterone increases bone density and muscle mass. Testosterone helps to growth of facial, pubic, and body hair. Testosterone therapy lowers triglyceride and cholesterol levels and improve cardiac capacity and output for better heart health. Testosterone plays a major role in fat metabolism as it increases lipid oxidation, normalizes glucose utilization, and lowers the risk of developing type 2 diabetes. Testosterone aids in the production of red blood cells in bone marrow. This can help counter the effect of anemia often found in the elderly population. Now I just discuss about the role of testosterone in liver. Serum testosterone is sorry ma'am. Serum testosterone is reduced in up to 90% of men with cirrhosis with level falling as liver disease advantage. Non-alcoholic fatty liver disease is associated with according to current concept, the deficiency of testosterone in cirrhosis is due to multiple action including both primary and secondary hypogonadism. Thank you, ma'am.
Very good. So this is what exactly I wanted. In this slide, she has given the answer that serum testosterone is reduced in up to 90% for men with cirrhosis. So that means if your liver gets damaged, now I'll come to this point. Okay, I can't share the screen now, no?
No.
Wait.
Do you want? Then I will stop share.
No, it's okay. You continue. I'll just read the point only over here. So I gave one function which was like metabolism of steroid. It inactivates and excretes aldosterone, glucocorticoids, estrogen, progesterone, and testosterone. So anything of excess of any of it will cause health issues. That's why liver has its role in excretion of excess amount of all these hormones. If you all, I don't know how many of you haven't gone through those, heard about this oral contraceptive pills. So if you Google that, you will find that maximum of it is your OCP is your estrogen progesterone combination. So when we say that when the female this on regular basis, if she takes this estrogen progesterone pills, so what happens that time? The chances of after 6 months or every year she should be checked for her LFT. This is the reason, because anything in excess will damage the liver. So if liver is damaged, then excess of these cannot be excreted from the body. That's why a healthy liver can help in excretion of all this excess amount of hormones. This was the same answer for your estrogen, for your glucocorticoids, and for the other hormones homework what I have given you all. Testosterone, when I gave the homework, nobody said that, ma'am, these all are hormones, so why their functions will be different? Happily, everybody took the homework, and I was waiting for this. This you will not get in Google. So you have to use your common sense. आंसर मिला आप लोग को?
Yes, ma'am.
Yes, ma'am.
So this is the answer. So that means for estrogen, when I said I will be discussing at the end, estrogen metabolism takes place in the liver. So when this liver is not functioning properly, it is not healthy, then estrogen metabolism, testosterone, glucocorticoids, aldosterone, they cannot be excreted in the body. And if they are in excess in the body, it will result in other health hazards. That's why this is also one of the most important function of liver. So with this answer, I have completed the rest of the presentation. So next, who is going to present? Koustav was there, na? Shomindu is there.
Koustav, please start your presentation.
Okay.
Only one answer for all the presentation.
Koustav, should I start? Yes.
Good evening, sir. Good evening, ma'am. I am
Good
Koustav.
evening,
Today,
Koustav.
today
बोलिए.
my topic is corticosteroids. Sir,
Okay,
first slide.
बोलिए.
First, steroid. We should know about steroids. Steroid is biologically active organic compound which are chemicals or hormone act as anti-inflammatory drug. Corticosteroids are a class of steroid hormone that produces in adrenal cortex. There are three main types of corticosteroid: mineralocorticoids, glucocorticoids, and androgens. Sir, next slide. Action of liver or glucocorticoids. Glucocorticoids promote gluconeogenesis in liver and gluconeogenesis in liver. It has two main functions: increase gluconeogenesis and decreases glucose utilization. It increases gluconeogenesis by synthesis of enzymes which are involving conversion of amino acid into glucose. Cortisol also increases the mobilization of
Actually, those who
amino.
are presenting, you should keep your video on. I forgot to tell Laboni. So at least for one minute, you keep your video on. Koustav, carry on. Rest, those who will be presenting, please keep your video on.
Cortisol increases the mobilization of amino acid into muscle to liver, and cortisol antagonize the insulin action, and also cortisol causes insulin resistance and inhibit the translocation of GLUT4 transporter from cytoplasm to cell membrane. Cortisol also decreases the protein synthesis in extrahepatic tissue, and cortisol increases the protein synthesis in hepatic tissue. That's why increases uh, plasma protein level. That's it. না স্যার এগুলো নয়, ঠিক আছে।
শুভেন্দু লাস্ট স্লাইড, এর আগের স্লাইডটা যাও তো. ইয়েস, এর পরেরটা. ওকে. The main point what you missed out here, you did not go through, or maybe I missed. In liver, high cortisol level increases gluconeogenesis and decreases glycogen synthesis. So this is the main function, because I'm asking you in context to the liver. So what happens if there is less glycogen synthesis? That means it cannot be stored for future energy. And gluconeogenesis means we don't want gluconeogenesis happen because we don't want the non-carbohydrate sources, proteins and fats to be broken down. Because if protein is broken down, so what happens? Your muscle wasting starts taking place. So now, if the liver is not functioning properly, definitely all these functions will also get hampered. Is it clear now, students?
ওকে ম্যাম।
Yes,
आपने
ma'am.
ठीक ही बोला है.
Sir, task 1. Okay.
Now who is presenting?
Ma'am Fatma, yeah.
हाँ, Fatma.
Yes, Fatma, good evening. Move on.
Okay, sir. Good evening, everyone. Today I'm going to give. Today my topic is aldosterone. Relation of liver with aldosterone. So before starting, I would like to give a brief introduction about aldosterone. What it is. Aldosterone, it is a steroid hormone synthesized in the zona glomerulosa of the adrenal cortex, responsible for electrolyte, sodium, chloride, potassium, and fluid balance in the body. Its main physiological role is increasing the absorption of sodium in DCT, distal convoluted tubule, and collecting tubule in kidney, salivary glands, sweat glands, and from gastrointestinal mucosa. And it also helps in retention of sodium in ECF, extracellular fluid. It increases renal secretion of potassium, secretion of hydrogen into renal tubule. So coming back to my topic, how liver is related to aldosterone. A pathway named RAS. Maybe many of us hear about this and many of us not. Full form of RAS is renin, angiotensin, aldosterone system. I have discuss aldosterone. Renin. Renin is an enzyme released from the kidney, which is stimulated by ECF depletion, by low serum sodium concentration, and by decrease in blood pressure. Now, angiotensin. Angiotensin is a peptide hormone. The precursor of angiotensin is angiotensinogen, which is a glycoprotein synthesized and released by the liver. Angiotensin, when there is a decrease
You
in...
just tell me when to change the slide, okay?
No, sir, there is everything is in this slide only.
Okay.
So when there is dehydration, sodium deficiency, or hemorrhage, there is decrease in blood volume. So when there is decrease in blood volume, there is decrease in blood pressure. This stimulates just glomerular cells of kidney to release renin. This renin will help angiotensin, which is synthesized from liver, to convert in angiotensin 1. This angiotensin 1 will convert it to angiotensin 2 with the help of angiotensin converting enzyme, also known as ACE. It is mainly present in the capillaries of the lungs, but can also be found in endothelial and kidney. One thing I want to mention about this angiotensin 2, it seems to be a factor of inappropriate remodeling of the heart after a heart attack, and this can cause significant morbidity and mortality in heart attack patients. Now, this angiotensin 2 acts on adrenal gland to release aldosterone. As I said, aldosterone is a steroid hormone. This acts on collecting ducts of nephron, causes the nephron to retain water. So when there is retention of water, it increases blood pressure. So in some people, it can be a problem. So for this, there are certain group of drugs which affect this pathway, like a ACE inhibitor. Like its name itself suggests, it inhibits ACE. ACE inhibitor block the formation of AG2, angiotensin 2, causing construction of blood vessel. This inhibitor causes the blood vessel to relax and widen, making the blood flow through easier, resulting in decreased blood pressure. The medicine also increases the release of water and sodium to the urine, which also lowers blood pressure. Now the second group is statins, which acts as an angiotensin 2 receptor blocker. And the third is aldosterone antagonist, mainly known as spironolactone. They are also known as potassium-sparing diuretics. They block the action of aldosterone, inhibiting the reuptake of sodium and water. Normally, when sodium is reabsorbed, it is exchanged with potassium, which then excreted. Since aldosterone inhibition decreases sodium resorption, it also decreases potassium excretion, resulting in potassium level. There are certain ACE inhibitors, maybe you all know, that's captopril, ramipril, that is Ramipac, lisinopril, quinapril, enalapril, all these. So with this, I would like to conclude that liver is the major organ metabolizing and thereby inactivating the lipid-soluble steroid hormone secretions of the adrenal cortex, testes, ovary, and placenta. It does this by rendering these substances soluble in an aqueous medium, thus facilitating their urinary or biliary excretion. For the metabolizing of cortisol, corticosterone, and aldosterone, that is secretory products of adrenal cortex, the liver play an almost exclusive role. Therefore, any disorder of liver may influence hormonal function and produce secondary endocrine disturbances. Thank you, ma'am, for giving me this opportunity. Over to Souvik sir.
I have neither changed the slide. You have at a stage told. So there are many slides you can see. So I was just fixed in this slide only.
Yes, sir. Yes, sir. All is mentioned in this first slide only.
This
just
slide,
for further. This is not my slide. This glucocorticoid
This is Koustav's.
Oh, this is Koustav size. It has jumbled up. Okay.
Yeah. So I have just 2 slides only, mainly 1 slide only.
But Koustav has not explained this, huh?
Ma'am, I can't explain this. That's why I cut it.
Okay. Chaliye. Very good, Fatma. Very good. Very crisp. Very clear. You covered all the points. And one thing, what she mentioned, that liver is the main organ which controls the secretion and excretion of the hormones related to your ovaries, estrogen,
Still stuffing
placenta.
time.
So she has covered it quite well. Very good. Next.
Thank you, ma'am.
I have, during the merging the slide, I think I have done these mistakes. This slide, whose slide is this? And
So this is
This
mine
one
only.
is Fatma's only. She only explained the whole thing.
okay. But I was fixed in this slide. Actually, this
No,
is
no.
very good.
Yeah, this slide she has
So
explained.
both are
Very good.
both are good. That's why I added both. But
No,
main thing is
this
in
one
first
is
slide.
very clear for the students to understand.
This one is
for
very
us
good.
to understand.
Very good. And she has explained it very well. Very well.
Fatma, your concept is clear. That actually reflects because you are explaining.
Acha, rest of students, is it clear now? Or it is
সবার
just
কাছে clear আছে?
because you can't ask me that, ma'am, explain me this. It's the person who is presenting. You have to ask that person to clear that.
বাকিদের clear হয়েছে কি?
क्या बात है, आज के students नहीं है क्या?
Yes, no, good, very good কিছুই তো বলছো
Yes,
না।
ma'am, it's clear. Yes, sir.
Yes,
Your
yes,
team member is only presenting and you are not
তোমরা একটু
responding.
অ্যাপ্রিশিয়েটও
whether-
করছো না, আমি বলেছিলাম ইন্টারঅ্যাক্ট করতে। গুড ব্যাড কিছুই বলছো না তোমরা।
স্যার ফাতমা খুবই ভালো বলেছে, ওর কাছে আমার ক্লিয়ার হতে হবে, আমি অনেক কিছু ক্লিয়ার
Very
না।
good.
Yes, it was very
সেটা তো
beautifully
you are also a
explained.
presenter. I want the audience to interact. You are also a presenter.
Chalo, next present kariye, then I'll start with the session. Next only 5 minutes I'll be giving for the blood clotting factor.
I don't have any objections for batch 1, batch 2. Voluntarily, you have asked for the link, you have joined. But why batch 3 students are joining on your own and leaving the session? I find Mamta has just joined, but you have not informed me that you will join 40 minutes late or 30 minutes late or 15 minutes late. How many times I have to say the same thing, that if you have any commitment, just tell me, or if you are outside, no need to join. You can ask for special request, you can get the video, but video is not everything. So every time I am asking the same thing, but still I am not getting this response. Shobik, you are there?
Yes, sir.
Okay, you can start. So tell your
Good
topic
evening, sir.
and then
Good evening,
start.
ma'am. Good evening, sir. Good evening, ma'am. First of all,
Komal,
thank you very much
just
for
कुछ
giving
देर
me
के लिए
Yes.
आप म्यूट रखिए ना,
opportunity.
नहीं तो उनका वीडियो नहीं आएगा। ये स्टार्ट।
Okay, sir. Okay, sir. Okay. My relationship is here is my topic is the relationship between the blood coagulation factor 8 and the liver disease. So here we can see there is a 13 blood clotting factor that helps in the blood clotting, and most of the factors are produced by the liver except from the 3 and 4. So the liver plays a major role in the blood clotting Sir, next slide please. But in case of the factor 8, there is a exception, because factor 8 is the anti-hemophilic factor. That means that absence of this factor, it causes the hemophilia disease. That means blood not clotting in proper time, that it clot to take time. So here is the decrease. Here we can see in these pictures, here is a decrease in other factor by the liver disease, but here is increase in the factor 8. But why? There is, move to the next slide. Sir, please, next slide. Factor 8. Factor 8 is actually synthesized directly, not the liver. Factor 8 is synthesized in the liver by the liver, but is synthesized in the endothelial cells of the liver. But whereas in the other factors are synthesized directly upper layer of the liver with the help of vitamin K, and that's why there is a main concern is factor 8 is not hampered in this case of liver disease, whereas the other factors are the reduced. That's all from my side. Thank you, ma'am.
You mean to say that factor 8 is not affected when you have a liver disease?
Yeah, ma'am. This is
Or it
the yeah, ma'am.
It is affected or it is not affected?
It is not affected
Why?
because मैम ये अगर affected होगा तो हीमोफीलिया हो जाएगा ना, मगर वो लिवर डिजीज में तो हीमोफीलिया नहीं होता क्योंकि ये तो डायरेक्टली
It can be
लिवर
one
सेल
of the
से तो कनेक्टेड.
complication of a liver disease, na?
हाँ, मगर ये तो डायरेक्टली लिवर सेल्स मतलब वो लिवर सेल्स से तो नहीं हो रहा है ना, लिवर का जो मतलब वो अपर सेल का जो नीचे है एंडोथेलियल सेल से रिलीज हो रहा है.
And what happens in liver disease? Only the upper cells of the liver gets affected, not the whole cells of the liver, not the hepatocytes. When there is a liver disease, only the upper part of the layer of the liver gets affected, or the whole liver. What happens in liver transplant then? Why liver transplant takes place? Anybody? Yes, definitely. Initially, it will not get affected if it's only a fatty liver. The upper part of the layer of the liver, as you have said, might be affected. But again, in cirrhosis, definitely it is affected. That's why all liver disorder patients, chronic liver disorder patients, they get vitamin K injections on daily basis. I mean, on a regular basis as advised. This is the reason why. Because if they don't give that, then the clotting factor will get affected. Definitely the clotting factor will get affected if liver disease is there. I'm not talking about mild liver disease, jaundice hua hai, symptoms hai. I'm not talking about those, but definitely in cirrhosis, in alcoholic liver disease, in an acute stage or in a very advanced stage of your NASH, definitely it will get affected. Because liver is getting damaged day by day. Then why it will not affect the coagulation? That's why for all liver disease patient, their coagulation profile is very, very important to see whether there is, blood clotting factor, that INR is normal or not. So it will definitely get affected. It's not that this factor doesn't get affected. It definitely gets affected.
Okay, ma'am.
Next, because see, if you if you go to your first slide, go to the first slide, Shomendu. You see the source of all it is from the liver. You only have presented, see, even for 8th factor it is liver. Now if the main organ gets damaged, then how will it function?
Yes, ma'am, is affected, ma'am.
You use your common sense, because I'm saying that, so you have to say yes, it's not that. If
No,
if my leg, I'll fracture my leg, say for example, then how will I walk? For me to walk properly, I have to repair my fractured leg. Then only I can walk. It is as same as that.
Okay, ma'am.
Organ ही काम नहीं कर रहा है, तो बाकी सब functions कैसे होंगे? So why it will not be affected?
বাকিদের কাছে clear হলো?
I don't know what is the problem today. Why nobody is responding? It's such an
ম্যামকে ভয় লাগছে নাকি? কেন?
তাই হতে
অসুবিধা
পারে।
কি হচ্ছে?
না, এখন আমার মনে হচ্ছে কি বলতো, বেশি প্রশ্ন জিজ্ঞেস করলে হয়তো হোমওয়ার্ক দেবে, সে ভয়তে বোধহয় ওরা আর কিছু জিজ্ঞেস করবে।
ম্যাম কিন্তু তা দেয় না। হ্যাঁ
এরপরে
জেনারেলি
তো
কিন্তু
আর
এরকম
এই
না, ম্যাম
সেশনে
তো সব
আজকে আর
র্যান্ডমলি,
হোমওয়ার্ক নেই।
ম্যাম কিন্তু র্যান্ডমলি চুজ করেছে। সৌভিক কোশ্চেন আস্ক করে বলেও যেমন পেয়েছে, আবার অনেকে যেরকম সারণ্যা তো খুব চুপচাপই থাকে, তাও তো ও হোমওয়ার্ক পেয়েছে।
না, সৌভিক তো
হোমওয়ার্ক কিন্তু
ইন্টারঅ্যাক্ট
এমনি
করে
কেন?
বলে দিয়েছি, ও তো ইন্টারঅ্যাক্ট করে, যারা ইন্টারঅ্যাক্ট করে তাদেরকে তো, যেমন নেক্সটে যাই থাকবে আমাকে এবার নেক্সট আমার তো লিস্ট আছে, স্বাতি বলেছে
আমি লিস্ট
স্বাতিকে
পাঠিয়ে
দিতে
দেবো,
হবে।
যারা একদম
হ্যাঁ
ইন্টারাক্ট করছো না। আমি খুব সারপ্রাইজড হলাম, কিছু কিছু আমি মেসেজ আমি পরে বলছি, যে এতদিন বলার পরেও বলছে আমি হেজিটেট করছি স্যার, কি দিয়ে শুরু করব, কিভাবে আপনার সাথে কথা বলবো। যখন আমি পার্সোনালি জিজ্ঞেস করছি তখন এই কথাটা উঠে আসছে। তার আগে তাকে তো দেখছি না, আজকে জয়েন করেনি। তো আমি যখন বলছি যে তুমি ক্লাসগুলো বুঝতে পারছো না, কি বলছে স্যার কিভাবে কি করব বুঝতে পারছি না, এখন বলছে আফটার 3 months has passed। কি
অফ করবো ম্যাম ভিডিও?
হ্যাঁ হ্যাঁ ঠিক আছে।
অসুবিধে
ওকে,
কোথায়,
আমরা
রাখো না।
হ্যাঁ তোমার থাক, আমি এরপরে তো মাহফুজা আছে। ঠিক আছে, তাহলে কি মুভ করব কমন?
হ্যাঁ হ্যাঁ অবভিয়াসলি।
চলো মাহফুজা, ওয়েলকাম।
Mafuza is from Bangladesh.
হ্যাঁ মাহফুজা লাবণী দুজনেই বাংলাদেশ। মিউট আছে মাহফুজা।
হ্যাঁ স্যার, গুড ইভিনিং স্যার এন্ড ম্যাম। স্যার শুরু করবো?
হ্যাঁ স্টার্ট।
হ্যাঁ প্লিজ।
Hello everyone, I am Mafuza Akhtar Munni, nutrition and diet consultant, Nabik Kurmirhat Hospital, Gaibandha, Rangpur from Bangladesh. Today I am presenting the progesterone hormone. Sir, এখানে কিছু স্লাইড মিস্টেক হয়ে গেছে, ডোন্ট নো হোয়াই। আমি একটু দেখে বলছি। First, I want to say about the progesterone. Progesterone is an endogenous steroid hormone involved in menstrual cycle, pregnancy, and embryogenesis of human and other species. It is secreted by adrenal cortex, corpus luteum, and placenta. Progesterone is an intermediate product in the formation of cortisol, and it can be converted to androgens and estrogens. Now we are coming, where is progesterone produced? The majority of progesterone is produced by the adrenal gland. Sir, সামনে
তুমি বললো স্লাইডটা কোনটা রাখবো, হুইচ স্লাইড?
Sir, second, third slide.
This is the function of progesterone you have told. Which is third
আরেকটু
slide?
সামনে।
This is first, second, third.
হ্যাঁ এখানে স্যার, আরেকটু
Okay.
সামনে।
আরেকটু
না, এটা শেষে চলে
এটা তো
এসেছে।
ম্যামই বললো। আমার কি কোনো স্লাইড মিস হয়ে গেছে?
স্যার,
দেখো তোমার তো পুরো আমি
দুইটা
কপি পেস্ট
slide
করেছি।
miss
This is your
হয়েছে।
progesterone produced. মিস হয়ে গেছে, আমি তোমার অরিজিনালটা আমি শেয়ার করছি।
প্রোজেস্টেরন
নাথিং,
প্রোডিউসড।
নো ইস্যুস।
না স্যার, ঠিক আছে, এখানে ঠিক আছে, প্রবলেম নেই, আপনি ওটাই দেন।
তোমারটাই
ওখানে
ঠিক ছিল
না, ওখানে আবার উল্টা হয়ে গেছে কিছু স্লাইড। না মানে আমি জানি না কেন এটা হয়েছে, একটা স্লাইড মিস হয়ে গেছে, প্লাস
उसका ओरिजिनल प्रेजेंटेशन दे दीजिए ना।
हाँ उसका ओरिजिनली मैं ओपन कर रहा हूँ, तो उसको जो बोलना है वो शी कैन टेल। 1 मिनट।
हाँ आप ओरिजिनल ओपन
তোমার স্লাইডটার নাম কি ছিল?
ওখানে প্রোজেস্টেরন।
তোমার যেটা পাঠিয়েছো আমার হয়তো কপি পেস্ট করে, যেমন কৌস্তবেরটা একটু গন্ডগোল হয়ে গেছিল।
না স্যার, আমি
There are so many in this third batch. How many students do we have?
আমি এক সেকেন্ড কোন জাস্ট আমি শেয়ারটা
স্যার
করে নিই।
আপনারটাই ঠিক
ও
আছে,
তুমি আমাকে
জাস্ট
বলো
আপনি
নো।
হোয়ার প্রোজেস্টেরন ইজ
আচ্ছা ঠিক
প্রোডিউসড,
আছে,
শুধু
চলো না,
ওটাতে
কি ব্যাপার,
দিলেই
তুমি
হয়ে যাবে।
আমাকে তোমার অরিজিনালটা হলে কি তোমার সুবিধা হবে, এটা তোমার অরিজিনাল। হ্যাঁ এবার তুমি জাস্ট নাম্বারিং বলো, তোমার অনেক, তুমি নিজেই বলেছো বেশি স্লাইড করে ফেলেছো তুমি। হ্যাঁ বলো
স্যার, হোয়ার ইজ প্রোজেস্টেরন প্রোডিউসড, এটা সামনের স্লাইডটা
দেখো তো, এটা
ছবির উপরের স্লাইডটা, যে পিকচারটা দেওয়া আছে তার উপরের স্লাইডটা।
আচ্ছা আচ্ছা, উপরে মানে আগে, বিফোর। হ্যাঁ বলো।
হ্যাঁ এটা হ্যাঁ। Where is progesterone produced? The majority of progesterone is produced by the adrenal glands. During the luteal phase following ovulation, a large amount of progesterone is produced in the ovaries coming from the corpus luteum. A smaller concentration of progesterone are also produced in peripheral nervous and brain cells. So next. So next. Now here is shown how is progesterone produced. We can see that in this ovaries, follicular ruptures duration ovulation, then create corpus luteum and produces progesterone. This progesterone is continuously produced if fertilization occurs. Function of progesterone. So next. Promoting overall wellness of the reproductive tract, producing calming effects in the brain by enhancing function of cells, supporting cardiovascular health by lowering blood pressure and inhibit coronary hyperactivity, modulating immune system activity by increasing levels of anti-inflammatory agents and assisting in liver and kidney functions. So next. Progesterone functions to maintain bodily homeostasis and assist with sodium excretion in the urine through the action of the kidneys. Progesterone also aids in stabilizing levels of copper and zinc in the body to promote liver health while regulating cellular oxygen levels. So next. If we want to know about the progesterone, we need a clear idea of the mechanism of progesterone. Progesterone is a steroid hormone. Its mechanism is very similar to the body's other steroid hormones, for their method of action. Due to the lipophilic nature of progesterone, it can readily cross the membrane of a target cell and bind to activate progesterone receptors located in the cytoplasm. This progesterone and receptor complex then transports to the nucleus and bind to DNA, specifically near the promoter regions of genes that contain enhancer containing hormone response element. This binding of the complex to the promoter can either enhance or repress transcription, which ultimately alters the production of proteins. So next. Progesterone is often used in birth control pills and hormone replacement therapy. Sometimes it causes hepatotoxicity. High doses of progesterone can cause liver enzyme elevations that generally rise after 1 to 2 weeks of treatment and consist largely of serum aminotransferase elevations without changes in alkaline phosphatase or bilirubin. These abnormalities are generally short-lived and resolve rapidly with dose modification and discontinuation. Thank you to sir and ma'am for giving me this opportunity, and thank you to everyone.
So, anybody, any doubt? Any question? Please ask her. Nobody. So I'll move to the session.
মাফুজা ভিডিও অফ করে দাও।
Okay, sir.
Nobody has any questions. So shall we start with the presentation, Shumendu?